At Santen, preserving eyesight while enhancing the patient experience is our singular focus. We are dedicated to finding innovative solutions in glaucoma, retinal diseases, dry eye, and corneal disorders so ophthalmologists can help their patients enjoy eyesight for longer. Learn more at santenusa.com.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Dr. Chris Johnson, Emeritus Professor of Ophthalmology and Visual Sciences at the University of Iowa Hospitals and Clinics in Iowa City, recaps his article, A New Era in Visual Field Testing, from the November-December 2020 issue of Glaucoma Today. In this article, Dr. Johnson covers the technological advances in diagnostic testing, which include tablet and internet-based procedures and the use of virtual reality headsets. Here's Dr. Johnson.
Recent technological advances are giving rise to novel tests of visual function. Diagnostic testing with portable, inexpensive devices now enables the evaluation of patient populations with limited access to healthcare and permits testing outside the clinical setting or at home. These changes allow more active monitoring of patients, increase the quantity of results, and can provide more timely information on the efficacy of current treatment and potential changes in visual status. Specifically, visual acuity, contrast sensitivity, color vision, binocularity, and other functional vision characteristics can be readily tested outside of conventional clinic appointments. Visual field testing is used to detect and monitor visual impairment related to glaucoma, macular disorders, and neuro-ophthalmic conditions. This article provides an overview of the use of tablet displays, virtual reality headsets, and internet-based procedures for performing visual field testing. Eye care providers have been able to evaluate the peripheral visual field for more than 2,000 years, with procedures performed manually until very recently. About 45 years ago, Dr. Franz Funkhauser developed the Octopus 201 perimeter. This device provided an automated method for eye care providers to conduct this method of testing. Since then, a number of automated perimeters have been developed, and this technology has become a mainstay for the assessment of peripheral visual field loss related to various ocular and neurologic disorders. Most of the currently available devices are expensive and are not easily portable, and they are operated by trained personnel. This presents obstacles to using them in developing countries, establishing vision screening procedures, and enabling patients to perform testing outside of an eye care facility. Recent technological advances make it feasible to use tablet displays, virtual reality headsets, and websites to perform quantitative visual field testing and other visual function procedures. Available as an app that is free to download, Visual Fields Easy, or VFE, allows a parametric screening procedure to be performed with an iPad tablet placed 33 centimeters from the observer. The VFE software presents a standard background intensity of 10 candelas per meter squared and Goldmann size 5 targets at an intensity of 16 dB. Testing is monocular a best corrected distance refraction is put in place for the eye being tested, and an opaque eye patch is placed in front of the contralateral eye. A red fixation point is presented in the lower left corner of the tablet, and 24 locations are presented within the upper right visual field quadrant. When this portion of the test is complete, the fixation point moves to the lower right corner, and the upper left visual field is evaluated with 24 test locations. The process continues until all 4 visual field quadrants have been tested. The observer can respond either by pressing on the screen or by pressing a connected USB response button. Catch trials are also presented to monitor false positive and false negative responses. As part of a screening program to detect glaucoma and diabetic retinopathy, the VFE test was performed on more than 400 eyes in Nepal. For comparison, more than 95% of the eyes also underwent Humphrey Field Analyzer, or HFA, 24-2 Swedish Interactive Threshold Algorithm, or SITA, standard tests. In addition, non-mydriatic photographs of the optic disc and retinal nerve fiber layer were obtained that were evaluated by 2 fellowship-trained glaucoma specialists. Some of the participants had not previously received a thorough eye examination or medical evaluation, but all of them underwent a complete examination by a fellow-trained glaucoma specialist for this investigation. There was a significant correlation between the number of missed locations on the VFE test and mean deviation and pattern standard deviation. There was also a good correlation between the percentage of missed test locations on the VFE compared to the percentage of abnormal locations on the HFA 24-2 total deviation plot and pattern deviation plot. The VFE test took an average of 3 minutes, 18 seconds to complete, and it had a higher false positive rate than the HFA, probably because locations that were missed initially were not retested. Overall, the VFE visual field screening program performed very well. The Melbourne Rapid Fields, or MRF, procedure was developed to provide a quantitative threshold visual field test that can be performed on a tablet or any visual display system through a website. MRF uses a Bayesian strategy referred to as zippy estimation by sequential testing, or ZEST, that is similar in principle to the SITA algorithm on the HFA. To date, MRF results have been reported to have a high correlation with those produced by the 24-2 SITA standard test procedure on the HFA, and the MRF procedure appears to be suitable for longitudinal follow-up, bedside evaluations, and testing at home. The MRF has a more limited range of intensity than the HFA, so the former incorporates larger targets for testing locations at greater eccentricities. For this reason, the sensitivity profile of the central 30 degrees radius visual field is relatively flat compared to the hill of vision that is typically obtained on the HFA for a size 3 target in a normal eye. By increasing the target size for greater eccentricities, the MRF is able to maintain a dynamic range of approximately 30 dB for the central visual field at all eccentricities. Sensitivities better than 30 dB, however, cannot currently be evaluated. 30 dB is the upper limit. The MRF can perform 24-2, 30-2, and 10-2 tests as well as a rapid screening procedure. The MRF test is slightly faster than SITA standard and slightly slower than SITA fast. The MRF reportedly has a coefficient of repeatability of 9.6% in normal visual field locations and 48.1% in areas of visual field loss. It is relatively unaffected by moderate changes in testing distance and ambient illumination, but it is modestly influenced by screen reflections, blur, and pupillary miosis. The interclass correlation with the HFA for visual field indices was high. For MD, it was 0.93. For PD, pattern deviation, it was 0.86. And the test-retest reliability compared to the HFA was 0.93 for MD and 0.98 for PD. The VFE and MRF are examples of emerging tablet, computer, and internet-based diagnostic procedures. Many other approaches have been introduced, suggesting that a new era in visual field testing is dawning. Virtual reality headsets can provide the additional advantages of standardizing test distance and minimizing the influence of head movements. The availability of portable, inexpensive, battery-operated devices that can interface with telemedicine programs should be tremendously beneficial for vision testing in developing countries. Similarly, the ability to conduct these tests in a waiting room or other area before a patient is seen by an eye care specialist should enhance the efficiency and cost-effectiveness of diagnostic testing and provide useful information to the practitioner. Home testing could facilitate the detection of changes in visual field status and improve treatment efficiency.
Thank you for tuning in to this episode of GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care coming up on GT the Podcast.